Hey, it's Dr. Birchler. One of the questions people ask when they're considering spinal decompression or decompression of the discs is really what's happening, how does it work? So I have a couple models here to give you a visual on what happens. But this is a model of vertebrae and discs between the vertebrae. And if you look through this way, this would be the spinal cord coming down from the brain down through the spine. And then there are nerves that come out between the openings of each vertebrae, and commonly, in the lower back, those nerves are going to go to the legs and the feet, causing sciatica and things when there's disc bulges. This model shows a disc herniation. So if you look at the the disc here, and this red goop in there represents you could think of it like jelly squirting out of a jelly donut, and it's hitting against the nerve there. Now, wherever that nerve goes, it's going to inflame, aggravate, and/or compress and decrease the function of that nerve. So that is, it's a fluid pressure from the interior part of the disc, like the jelly in there. And if it's torn the whole way through, that jelly squirts out. So what can you do mechanically to change some of this? Well, a couple things. First off, many disc bulges, especially with a degenerative disc, they occur the whole way around, or a large portion of the disc. They call it a circumferential bulge. So you can think of it like a sagging mattress. Like instead of one spot that's ripped in a mattress, it's kind of a broad area. It's just sagging, so that it's like the disc is just bulging out around the rim of it. So when that happens, really what needs to happen, if you were to look at the spine and the lower back of these discs here, if that is compressed and squished or bulging in the disc, mechanically what needs to happen to get it to recenter is it needs to do that. Okay, so there's a compression of it, and then the traction is going to decompress it, elongate it, and allow it to recenter or suck towards the center. So some type of repetitive decompression on the disc from compressed to decompressed, allowing the jelly to suck back towards the center. And what's neat is on MRI studies, it actually shows that in post-treatment MRIs, there's actually a higher fluid concentration in the disc, which is good. And disc height actually will increase. Both MRI and CT scan or CT studies have been done that demonstrate an increased average height in the disc. So the disc literally does like regrow. That traction allows fluid to get to the disc. A disc does not have blood to it, so you can't get circulation. But there is a fluid in the disc. And the only way it gets that fluid is through mechanical movement, which is called imbibition, but it's almost like the idea of a sponge sucking fluid into it. So it has to mechanically have this pumping to allow fluid and nutrients to imbibe the disc, and if done repetitively, the disc does have a limited capacity to change and to heal. So that's what's going on the inside with decompression, and what makes the DRX 9000 lumbar decompression equipment that we have very unique is that it has an automated way to do that. It minimizes any reactive tension in the muscles that are going to kind of keep that disc from being able to expand and decompress. So you really get the maximum effect of that decompression. Hope this helps.